officially by saying thank you, everybody, so much for making the time out of your very, very busy schedules to make the time and come here. We're so happy to have this special educational event, especially during the month that we're all celebrating International Women's Day. This is a female world here, and we need to support each other, and that's what we're all about here at mobileODT. I have 3 sons myself, and I can guarantee you that these boys are being raised to treat all women with the utmost care and respect. Okay, can we have the next slide?
Oh, look, I went too fast. Sorry, go ahead.
That's okay. I wanted to, this is the agenda we're going to go over, so we're not going to spend too long on this. You'll just see as it flows. And I wanted to say thank you guys to you, my Sangels. You guys, I came up with this terminology because you guys are angels of the universe. Literally, you are angels of the universe doing this amazing work. So thank you to all of my Sangels, and the whole country thanks you. And I think we even have people dialed in from who are doing this work in other countries as well. And now I would like to hand the floor over to Morgan Stebens, and she will tell you all about herself.
Hello, everybody. So officially, I'm nervous because this is the first international webinar I've ever taught. I've done national ones, but nothing international. So this is really fun. I'm excited. I was really honored that Rivka and her team asked me to do this presentation. We've had the opportunity to use the EVA system and mobileODT for a few years now, and so it made a huge difference for my team. And so I was really excited when they asked me just to kind of give a little bit of overview on how it works. It's very user-friendly. So I am currently the Forensic Program Coordinator at the University of Kansas Health System in Kansas in the United States. I know some of you are from other countries, so I'm excited to be able to share what we have learned. I started my medical career in the military. When I was 17, I joined the Army and I was a medic. I deployed to Iraq in 2007 and 2008, so I've had some, in-country experience. And then I got married and had babies, and got my nursing degree whenever I had kids. So I started my nursing degree a little later. I've been at the health system for 6 years now. I took over the forensic program about 6 months to a year into my time here. I got my sexual assault nurse examiner education, and then I went on to get my SANE-A certification through the International Association of Forensic Nursing. So I absolutely love my job. I love what I do. And I'm really excited to do this presentation. So first, though, I wanted to talk, before we do the live demo, I wanted to talk a little bit about sexual assault or sexual assault forensic nurse examiners. SANE and SAFE are used interchangeably where I'm from, but I learned that other people use SAFE, so we use SANE. So those are both the same things: sexual assault nurse examiner and sexual assault forensic exam. So just so you know, if I use that terminology, it's interchangeable. During doing exams during COVID and what it looked like, I know that a lot of programs faced a lot of the same fears when COVID first started. We saw a significant decrease in patients that were coming in to have exams done across the spectrum of forensics. So at KU, we don't only do sexual assault exams, we also do domestic violence and other interpersonal things like elder and child abuse and neglect and vulnerable adult abuse and neglect. And we know that, during a time of stress and, when the lockdown occurred in many places, we know that violence increased, but we were seeing a decrease of presence in the hospitals. And so, around here in the Kansas City metro area, we got together as SART teams. So our, multidisciplinary teams in the city decided that we needed to figure out what we needed to do. So we looked at all of our governing bodies, like the International Association of Forensic Nursing and, other people who were talking, and decided we really needed to identify a better way to provide care for our patients. So we, not only did we know violence was increasing, we saw less people coming in. So that was a big concern. One of the things that we first talked about was identifying somewhere other than the emergency department to do these exams. And so some people reached out to clinics that they had. We reached out to our OB inpatient clinic, which is still in our health system, but is away from the ER, as a way to say, okay, we have a safe space for you to come if you're concerned about coming to the hospital. Because not only did we see a decrease in people presenting to get sexual assault exams and care for domestic violence, but just a decrease in patients in general because they were terrified to come to the hospital and get COVID. So we partnered with our local advocacy group, our SART teams did, and we put out a press release that said, you're safe to come to the hospital. We're still providing all services. Please don't hesitate to come and get care, and we put it out across the metro. Things like no visitors with patients, so they're support people, and can we provide exceptions for those things? What about advocacy coming in? We saw advocacy do a lot of phone advocacy as opposed to being at the bedside, which, we know isn't the best for the patients, but it's what we could do at the time. And then allowing those support people to come in with those patients. So, we really had to identify some unique ways to help care for these patients. And then if it was offsite, how could we get them the medications that they need? And then reporting to law enforcement, with law enforcement or whoever takes your reports come into the hospital, because that was an issue we were seeing as well. So we had to coordinate with those people too. When we look at the current guidelines, and this is through the IAFN, so the International Association of Forensic Nursing, and I do want to say I am in the hospital right now. So if there's noise behind me, I'm in the ER, so there's likely to be a lot of noise. So I apologize for that, but that's my reality right now. So we are following all guidelines from IAFN and CDC. So the proper use of PPE when you're going in to do the exams is extremely important. And I know that in the beginning, our team here definitely saw a shift in PPE. So we started with like heavy use of PPE, right? And then at one point we had Tyvek suits that we were wiping down with bleach after each patient interaction. And then it kind of eased up as we learned, what was appropriate to wear and what would prevent any disease from occurring or transferring. So we're utilizing the standard precautions and to reduce the risk of infection. And then also, one of the things that the IAFN came out with was having the ability to go to a different space in your facility or find a different space in your facility. And then how you collaborate with your multidisciplinary team. So if you have police come to the health system, how can you do that? Can you combine all of that care together and have advocacy and police and everybody come at the same time so they can get in, everybody can get their information at once, and then whoever needs to leave can leave and whoever needs to stay can stay. And then one of the things that we talked about, that was kind of a hot topic at the time, and we're going to talk about today, which is a benefit of utilizing the EVA system, is telesane. And so a lot of people were seeing it as a way to help guide a patient through their own collection. And we know that that's not what's best for the patient. When we talk about telesane, which is a benefit of the system, it's talking about having a certified professional or a specialized individual like a SANE or safe nurse guide another medical professional through evidence collection. So I live in Kansas. It's called the flyover state. It's because we have a lot of space in rural areas. And so for us to be able to utilize a telesane system is extremely beneficial. Around the country, a lot of people do this for stroke. So if you live in a rural area and you have somebody who is having a stroke, they'll use telesane to guide them through the exam process for a stroke. It's the same for a sexual assault. You can guide another medical professional through that process. And so this is a significant benefit to be able to provide patients care where they are and they don't have to travel a significant distance to have it done. this utilizes HIPAA compliant platforms. There's significant security around it. You may have to go through, you know, there's anything that you introduce into your system that you don't have, you might have to jump through some hoops, which we have. We've gone through risk management, we've gone through our teams to do a risk assessment, but there's a portal that comes along with the system as well that gives you ease of communicating the images and the annotations that you have collected. You can just send a link to prosecutors and detectives and investigators as a way to share one single case. And so, there's a lot of security around it too. I'm not an expert on that, and we'll touch on it at the end. I think Rivka is going to touch on it. So, but that, I just wanted to mention that as a benefit. So as we're talking about telesafe or telesane, really it's the process of utilizing the system. It's on a Zoom meeting. So currently I am on this meeting on the system, and you guys will kind of see how it works. But I can Zoom into a meeting with another healthcare professional, and they can see exactly what's happening on my screen. So if I'm taking photos or if I'm taking a video, they can see, you know, injuries that are in the vaginal vault or maybe on the cervix. They can see, you know, they can assess what's happening and whether or not that patient, if they're in a rural area, will need transferred out for more care. Or, you know, as a way to identify injuries that you might not know what you're looking at, or something that somebody else has seen before and you aren't quite sure what to call it. So it's beneficial because you can communicate between long distances, and it's also beneficial for your patients because they can get specialized care in the space that they're in. So one of the things that it helps with as well with COVID is it reduces the need for contact between people. And so you're reducing the risk of exposure or the risk of transfer of COVID-19. If you have a patient who has COVID-19 and you're doing a SANE exam or a SAFE exam on them, you can work with other hospitals or institutions. You can learn from each other. It's a great learning tool because then you can communicate with other people. I know that our SART team, you know, we do a lot of case reviews, and so it's very beneficial to be able to utilize the system for case reviews. And then as far as waiting time goes, we talked about that being more accessible for patients, and that's always a benefit when you have things that are more accessible for patients. So the clinical use cases that we have here, depending on what capacity you work in, we are a full forensic program is what we call ourselves here at KU. We can do sexual assault exams, we do domestic and interpersonal violence, we do elder and child abuse and neglect, vulnerable adult abuse and neglect, and then I've even gone as far to do a dog bite on somebody who needed to have some pictures done, didn't have contact with police or needed to get here quickly. So we've gone as far to do those things too. And you can extend it out to things like, you know, going to the ICU and taking pictures of maybe a gunshot wound if PD needs your help, or, you know, there's all kinds of opportunity for this system. So now we're going to go to the, okay, wait, I'm going to go one more to make sure. Yes. Okay, so we are going to go to the demonstration, the live demonstration now. So I'm going to stop sharing this screen and I'm going to share my screen on here. So it is literally just, okay, I got to close out some of these screens. Bear with me. Okay, it is just a phone. So it looks like a phone. It's not just a phone. I don't want to say that, but it looks like a phone. It's this system right here. It comes just like this. And one of the things that my team told me was, you got to get us a case or we're going to break our system. So I ordered an $8 Amazon case from Amazon, obviously. But that was one of the recommendations that I gave to Rivka, and they are actually putting in a process to provide a case for these. And so a benefit to utilizing mobileODT or to utilizing, you know, the support that you have is that you can submit suggestions. One of the things that was submitted was like a high contrast for pictures. And Rivka just showed this to me because we just got an upgrade. So I'm going to show you what the upgrade looks like. So I'm going to go to the app catalog and you're seeing exactly what I'm doing. It's the EVA system. Actually, you know what? I'm going to show you a different way to get in. Ooh, hey-o. Nope, that's not it either. Sometimes you have to play with it. We're gonna go through this way. Okay, and I'm gonna open the app, and that's what it looks like to get in. So you'll have your own unique setup, and you have your own unique PIN. You log in, and you really go to what it says Start Forensic Exam. It's that easy. So I'm going to click on Start Forensic Exam. You put in your medical record number for your patient. I'm going to give y'all a heads up. I do have a pelvis that I'm utilizing, and I'm going to show you a speculum exam. So there will be, it's a mannequin that is a vagina. Last name. That's an old military term, just so y'all know. And then you can actually change the birth date. If you don't want to put in their birth date, you don't have to. You can just change it to age. So I'll just put 34, contact phone number. And then there's this button, add additional details down here. It has all the things that you need for your exam. So all the information that you would collect, what SANE examiner was doing it, when the patient arrived, the day the patient arrived, the time, you know, that the SANE was called, the day that the call was made, when they arrived. So the date of the assault. And this can be added in at any time. So if you don't have time to do it, or say your patient is sitting there and they're like, I need to go, you don't want to add in all this information now, because it's a lot of information, but a lot of it is really beneficial. You can get out of it and you can go to Start Exam. Okay, so you are literally seeing my screen. I'm going to show, oh, hey, let's not do that. I'm going to show you one of the cool aspects of it. So I'm going up to the settings button, which is the one to the right of the X. So you have two different capture modes. Okay, you have the colposcope mode and the capture mode. Capture mode is full body images, and the colposcope mode will look like this when you log in. It'll be turned around because you're going to use the stand system. This is your colposcope. It's this big. It's teeny tiny. One of the things that it comes with, okay, I'm going to put this down for just a second and get this off. One of the pieces that it comes with is on the stand, this little black piece right here. And I always like to talk about this because I've bumped it before and it fell out of the stand. So you have to be really careful. You always learn from your mistakes. There's a piece in here that you have to pop up, and it's a level. And so you can see it, this little piece right here. You untwist it, unscrew it, I guess, not untwist. And it's a level, and it goes on top of the stand. So this is your colposcope. It's lightweight, it's very beneficial. And then this piece actually clips in. So your stand moves up and down, all the way down, out of sight, and then all the way up. And this piece moves, you open it, and this piece kind of turns. So you can angle your camera however you need it to angle, but this piece slides in and out. Oh, you can't see anything. Oh, you know why? That's because I think I'm sharing my screen. Okay, I'm gonna turn this around and I'm gonna capture it. Do capture mode again. Okay, I guess I'm gonna turn this around so you guys can see what I'm doing on the camera. Okay, I'm gonna go slow because it's, okay. So this little piece right here is what I'm talking about, and it goes on this stand. So here's your stand. It moves up and down, and I'm doing, what you're seeing right now is me on the phone, not on the computer. So this piece slides right in here and it clicks. But if you bump this right here, it'll fall right out. So if you have it connected to your colposcope, you have to be really, really careful. So I like to attach it first so I have a better grip of it without trying to spin it while it's on the stand. So I'm going to attach it, and it has a level on it too. Not that you need the level, because sometimes you really need to get different angles when you're taking pictures, but then it'll just click in, and that's as easy as it is. And this moves up and down to get different pictures. One of the best features on it, okay, watch your eyes. One of the best features on it is that there's a light source here. So if you can see, There is a power button. That's for your light source. And there's your light source. Tighten it back up. So I'm going to turn that light source off, and it has different charging ports. So you have a charging port here for the actual system, and you have a charging port for the actual colposcope, and you have a port here that where the system sits in it, the camera sits in here. You can plug it in if it's in here as well. We often just keep it out and do full body photos first, and then go from there. So when you're putting the phone inside, okay, I'm sharing. When you're putting the phone inside the system here, I'm going to show you kind of how to, this moves back and forth. You can see how it moves. Pull this up. Okay, I'm going to ask a question and see if somebody can answer me. Rivka, maybe you can answer me. Can you see me on the Zoom screen, or are you?
Yeah, I see you on both, and everyone seems to be able to see you now from the chat.
Is everybody good? Because I want everybody to be able to see it.
Yeah.
Okay, perfect. So I want to talk about how you put the phone in. I'm glad, because I'm going to put the phone in here in just a second. This piece slides, and it works. It's not hard, so you shouldn't ever have to like jam or tug. And so when you put it in, it just slides in to a couple of little buttons down here, sits flat, and it clicks. Oh, I don't think you could hear the click. Okay, and so this face is secure. To get it off, all you do is move this piece over and lift up, and it comes off really easy. Okay, so I'm going to put the phone in the system now. Okay, flip it. Go nice and slow so I don't make y'all sick. So currently we are in capture mode. So I'm going to go to colposcope mode. And everything is flipped when you are in capture mode versus colposcope mode. Okay, why? I'm going to pop out of here real quick and get it in. Okay. So now that I have it in the system, we can take pictures while it's in the stand. And I'm just going to kind of do, I have a pelvis that I'm going to do, use it on, and I'm going to do a speculum exam. Okay, let me go back to start exam and make sure you can see what's happening. Okay, so your colposcope is actually a magnifier, and that's why you want to use it, because you can get really great pictures of the cervix. All right, all of my file folders. So here's my pelvis. I guess I should have warned you guys you were going to see. I'm now showing you the vagina, the vaginal opening. Okay, so here's my patient. Oh, Rivka, you had a comment there. Okay, so I'm going to move this back just a little bit so you guys can kind of see. Breaks off here. Okay, so here's my pelvis. This is what we're working with. So that's my patient laying on the bed, okay? This pelvis does not have a cervix, so FYI. There we go. Okay, so if you can visualize what it would be to, you guys are on a Zoom meeting right now, so you're actually seeing what I have on the screen. This is what it would be like if you were in the space with the patient and you had another healthcare professional that was on that Zoom call with you, and you were like, I don't really know what this injury looks like. I need help identifying it. Then, you know, or you're concerned about an injury that the patient might have, or something more specialized that needs done other than what can be done in your institution. Okay, so I'm going to insert. So this is what your picture is going to look like. See how clear that is? No, of course I don't have a cervix in this one, but you can see down into that vaginal vault. Now I'm going to capture a photo, but you can also zoom in. So if you double tap, oh wait, do I have my double tap on? There's also a hand wave feature. Okay, so I'll come back to the zoom. If your hand wave feature is on, you can stand and you don't have to push the button. You can just wave your hand. Let's see if it'll work. Did I have it on? Did you see it? It was on.
It's also, it's like, you think of it as the high-fiving the little eye at the top left. That's where it'll, if it's on, it'll capture it.
I did it.
Yeah, okay.
So if you guys saw what I did there, I just took my hand and waved it in front of it and it took a picture. So I have the ability to sit the stand and the colposcope in one spot and use my hands to spread tissue to get a really good picture of any injury. And I'm looking right down into, you know, the vaginal vault where you're going to have that cervix and getting really clean shots of those injuries that you might be seeing. Okay, so there's also video. And so you can take video, and if, move that up, you can go back. So I'm going to start my video. If you have somebody who's squirming, so say you're doing a child or something, they're squirming all around and you're not going to be able to get really clean pictures, you can start your video and then you can go do screenshots of that video to get photos. So there's benefits in using the video as well. And then when we're done, you can go, you know what, did you guys see the zoom feature? See, off to the right is your zoom feature. And you can zoom in and out as you need if there's other injury to be able to see. Okay. All right. So we're going to go look at annotations now. So you can make notes on the actual photos. I'm going to go back to media files. I'm going to turn my chair here just a little bit. Oops. I'm going to get out. All right, I'm going to go to this home page so you guys can kind of see what I'm looking at. Your home page is really, really important. I'm going to show you annotations in just a second. Your home page is really important because you have your exam list of patients on there. And then you can export your exams if you want to save them. Maybe you're using a secured drive. I do have the updated version. I have the updated version. Allison, you might have an older version.
I'll address that later as well.
So you can export your photos. So say maybe you haven't had clearance from your hospital or health system or institution yet, and you need to download those photos from the phone to your secure drive. You can still do that here. And then if you go to your about, of course, that's all of your information for your phone. You can turn on notifications, and then you have support right in the app, but you also have the ability to go in and do some learning. So I'm clicking on learn first. And you have this at your fingertips. As long as you have Wi-Fi, you have the ability to go in and take a look at what you might need help with. So your user guide is here, installing your new app. So Allison, you're going to have to install that new app. When it updates, you're going to have to just go in and like reset all of your stuff up. So information about that, updating your app, logging on for your first time, resetting your PIN, learning how to capture those really great quality images. And, you know, and like anything, it takes time and it takes practice. But the best part about this is that it's a lightweight system and you can take it anywhere. So for training, you can really utilize it at home. You can take pictures of families' injuries and really get some good use out of it when you're practicing. So all of these items are under the Learn tab. Okay, let's go back up here and go to our images. Okay, so I'm going to go to this media file. I'm not going to go to the, so I just clicked on the picture. If you see where the target is, that's where I clicked. So know that when you're putting an annotation in, if that's not where I wanted it, I'm just going to go to the X, pop back out of it, and I'm going to touch where you focus it when you are happy with the image, you leave in that position. Yes. Yeah, if you're happy with the position that you're in and the view that you're in, I would leave it and then take pictures from there. But you have the ability to move it around, so you can move it to different places that look. So, for example, yesterday I was able to get pictures of her cervix, but then I needed to adjust it just a little bit to get pictures of the vaginal wall because there was injury on that vaginal wall. And so you just kind of turn it just enough to look down inside the vault and get pictures of those injuries that might be on the wall. And then, so say there was an injury, you know, on some of the tissue here at the, let's say at the 5 o'clock, I click right there at the 5 o'clock and say there's a laceration. So we'll add laceration. And I just move that up with my finger. Oops, I didn't spell it right. Try that again. Thank goodness for spell check. But for real, I always use spell check. And then click the check mark and it's on there. So now when I click the target, it has my laceration. You can put size, you can add whatever you want into that annotation. At the bottom left part of the screen, if you see the eye, you click on that eye and it will show you the image without annotations. So you can send the images with annotations and you can send the images without annotations to investigators and prosecutors if they need it. So there's your annotation. And then if you I swiped left, kind of like a dating app, I swiped left and you can add any annotations to all of the pictures that you want. So this is a new picture, new annotation. Oh, hey, I didn't know I got that one. So, and that's one thing too, is sometimes if you have that hand gesture feature on and you don't want it on, remember to go turn it off, because if you have someone who's moving a lot, they might set your hand feature off, and that will cause a lot of extra photos that you might not need. So, you know, when you're in the beginning, I would double check and see what features you are on. So things like the colposcope mode, if it's, you know, upside down and backwards, you're in that colposcope mode. And if you want to take just full body photos, then you go back in and turn off the colposcope mode. And so we'll go back and go back in. So say I want to add a clinical impression. You can go in and do some clinical impression as well. When you're talking about adding anything in, you can get all of your information from your patient first, and then you can go back and add this stuff in later when the patient, you know, when they're getting out and they don't have to sit and wait for you to do this. That's a huge benefit of having this. Okay, I'm going to go back to my camera. So your media files, if you click on the camera, it's going to take you back to your camera. And then you can go to this, there's the bottom right corner. Remember I was talking about that high resolution picture? That's what we're in now. And if I click on, or we're not in it now, and if I click on it, you move into it. Research is showing that this helps with bruising, identifying bruising on the neck for strangulation cases, or if you just want to get like a little bit better picture with contrast, then this is the opportunity to do that with the filter. Let me see, you have a timer up here. So if you need to utilize that timer, you can. I don't know when I would ever utilize a timer because I feel like it's a very precise thing to have to do.
Yeah, that's for the colposcope. When somebody's conducting a colposcopy, we have that built in for that. But go ahead and use it if it suits you guys.
It's on. I don't know how to turn it off because I don't ever use it. But
okay, just click on it.
I did.
Oh, we did. Oh, press on the camera.
Okay.
No. Okay.
It's fine.
Okay.
We'll just let it go off. We'll see what it does.
Yeah. It's on a timer. It's cool.
But this isn't just utilized in a forensic setting. It can be utilized in an OB setting as well, to take a look at that, the vaginal vault and the cervix for abnormalities. So that's a benefit of it as well. And then to be able to download your pictures and share them through the portal is extremely beneficial, because we did hand-to-hand face-off, but when we have the portal application approval, or you'll be able to just give a link to your investigators, so there's no contact there either, and you're reducing the contact that you need to do for transfer of evidence. So, and that, did I miss anything? I'm gonna finish my exam now. You can export it to a folder from here, or it automatically uploads into your portal. It syncs into the portal over a certain period of time. So
I'll talk about those details also later, so no worries.
Okay, so that is the demonstration, and I wanted to give y'all enough time to ask questions. Are we doing questions now, or are we finishing? Do you want to finish?
We'll save those questions for the very end, and we'll finish everything. Okay.
Okay, I'm going to stop sharing this screen. Let me see if I can figure out how to do it. Ha. Okay, slide that out of the way, and then I need to reshare. I love the Zoom stuff, right?
You are doing so beautifully, Morgan. Thank you so much.
Okay, let's reshare. Is that it? I don't think that was the right screen, Rivka. Hang on just a second.
I think that was.
No, it was the.
Oh, there we go.
Okay, so after that demonstration, I think Rivka's taking over after this to talk about your.
Yeah. Okay.
So this is just another slide about what we talked about, how you can annotate on your documentation, that it's a safe solution for doing telesane or telesafe. Your colposcope already has a microscope in it, so your zoom is automatic. And honestly, I have to say, going from a regular camera that you would learn on, because that's a lot of education for a very specific skill, to learn how to take the best photos you can on a regular camera. The ease of moving from a regular camera to the EVA system was second to none. You don't have to worry about your aperture, your f-stop, or if you're far enough away, or a macro lens. So that eliminated all of the need for the education on a professional camera. So I'm very glad that we switched, because this is so much easier to utilize.
That's amazing.
Okay, I'm gonna mute.
Okay, I wanted to, since we'll segue over to the HIPAA compliance for a moment, just tell me if this is correct. I've heard, Morgan, this is for you. I've heard from my SANE-Jils that when they're training new SANE-Jils on the device, they cut down their training time from 4 hours to 15 minutes.
Yes, because you're not having, well, like I just said, you don't have to do the education on a professional camera where you're learning the importance of light, the importance of how the lens zooms in and out with that light. If you have to change your lenses. So this system is it's all encompassing. And so it really did cut down the need for that really lengthy education to this really short education where you can get on and play like a phone. Like, how quick do you get on your phone and learn a new app in, in no time? So really, yes. Yeah, it did cut it down a lot.
Okay, and we had a question. I'm going to address all of those questions. You guys can keep typing them in and we'll get to them in just a little bit. I just wanted to talk about the aspect of the HIPAA compliance. And you could see here, of course, we all know why it's so important to have something that's fully HIPAA compliant. So both the EVA system and the portal are fully HIPAA compliant. And we host all of the information that's on the portal is hosted in Virginia using Amazon Web Services, which is tier 1 in security in the world. We are used by lots of very large health systems across the US that have put us through very rigorous IT checks, as I'm sure you can imagine. Morgan's team is almost finished their process, so they'll be on with the portal. The benefit of the online portal is huge because everything that you're doing on your EVA device will be automatically, when you're connected to Wi-Fi, will be automatically synced, and you can view, edit, do anything that you've done all on the online portal, which is super comfortable. You could open it from any web browser. That's also how you would share it with law enforcement. And as we have many, many layers of security, we are a company that was born in Israel, and you guys know that Israel is top in security. That's like what we're all about. So that also gives people a good feeling. And can you go to the next slide? There we go. Just to give you guys an idea that you're in good company. You're in good company. These are systems that are trusted, and we see you guys as partners with us, and we're always here for you guys, available to support you. You guys are on the front lines. The way just like a quick little background is that we originally were founded in 2012 by a social entrepreneur and a bio-optics PhD who got together, and they said, why are women dying from cervical cancer all over the world when it's one of the easiest cancers to prevent? You just need to expand access to care. So they came up with this idea of taking the technology of a cell phone that everyone knows how to use, it's super affordable, built an optical lens device around it, made it smart, connected, and portable. And then very soon after that, they realized they were in the perfect position to support the sexual assault forensic community in the forensic exam. As, of course, best practice is colposcope, and I'm sure you guys, you SANE-Jills know that, first of all, if you're lucky if you have a colposcope, and then just like the camera, how are you going to remember to use the colposcope? And then it breaks down and all that good stuff. This eliminates all of that. You get your colposcope and your full body image camera, everything all in one. We want to make, you guys are on the front lines. You're doing the most important work. Let's make it as easy as possible for you. There's one other benefit of the EVA system, and I'm curious if Morgan has anything to say about this, is that it's very, the patient engagement factor. Nowadays, people want to be engaged with their healthcare. It's not like we go to the doctor or whatever and just like, you know, we want to be engaged. That's also as a colposcope, when the doctors are using it, they can turn around the EVA device and show you a picture of your cervix, and an engaged woman with her body, obviously. It's, you know, reduces loss to follow-up. It's all about engagement. So I wanted to ask Morgan also if that using the EVA system as maybe less intrusive than a camera, and just what the patients feel.
Yeah, I think one of the things about it I always preface is this looks like a phone, but it's not. The communication is very private, and so I like to interact with my patients in a way that helps them start to process what has happened. And so I'll ask them if they want me to share their photos. You know, if I see something, do you want to see it? And so they get to engage a little bit more, you know, as opposed to with a big clunky camera, or, you know, that can be really uncomfortable. And I can just, you know, pop in, pop out and show them their pictures. And so a lot of people, I do have a lot of patients who look at their photos.
Thank you so much. Do we have a screen after this? Another slide? Okay.
There we go. Now it's question time.
It's question time. I am going to just make an announcement that as a token of our appreciation to everyone attending the webinar, anybody interested in making a purchase, or we are giving you a 10% discount on your EVA system purchase. If it's a second one, if it's a first one, as a token of our appreciation. So thank you. And now let's open the questions. Okay, so we have one question of how long are photos stored on the portal? Those are stored forever. They're on the cloud, and they will be there forever and ever and ever, just like everything else on the cloud. Let's see. In the chat, I think we have, does the EVA, oh, Scott, does the EVA integrate with EMR systems? So that is an excellent question. We don't have automatic integration. However, with 3 clicks of the button through the portal, you easily upload any of your cases into any EMR, whichever one you're using. For example, let's say I'm using Athena or Epic, whatever. So I will go into my portal and I will click into the exam. I will click one button that says download. And then once I could choose to download the exam either as a zip or as a PDF, and I'll be able to simply upload that with the images, with the annotations, everything right into my EMR. Yes, I can share my, oh, Morgan, can you share your contact information?
I don't think I put my, yeah, absolutely. I can share my contact information. My email is Stebens, S-T-E, B as in boy.
Should I put it in here?
Yeah.
MSTEBENS
at kumc.edu.
At kumc.edu. Okay, that's Morgan's email. Let's see, how do you make the pictures clear? You have trouble refining the resolution.
So you don't ever have to go in and refine anything. It's all about when you're taking the photo. I found that, you know, if you take the photo and you're seeing that it's blurry, then you just adjust your system and you get really clear pictures at that time. So when they upload like they look on the screen. It's not like when when you have this handheld camera, sometimes they look a certain way and then you upload them and they're blurry. What you see on the screen is what you're getting. So if you're a little blurry on the screen, you just kind of adjust your zoom, you adjust your camera, you adjust your system, and you get to a point where it's clear, and the picture that you take that's clear will be what's uploaded.
Okay, so I'm just scrolling back. There are a couple more questions. One was, can we email you guys the recorded webinar? Absolutely. Everybody afterwards, once this is over, we'll send everybody who wants a recording, no problem. There was a question about, can we please discuss how to do the update? So that is something I can absolutely help anybody with. It has to do with when you were migrated to the new software. So I can address that question. Some people who have the EVA system noticed that Morgan was using different software than they're used to. That's because we've been slowly migrating all of our SANE-Angels in groups. So if we didn't get to you yet, we will get to you soon. If you want to know when, you can send me an email. Here, let me put my email here as well.
And I have to say the transition was really smooth. I did it actually. They did my upgrade very recently, and I had a patient and I hadn't upgraded it yet, and I literally did it within 5 minutes of being in room with a patient. So it's not a difficult transition either.
Excellent. Thank you for that. You literally just experienced it. How do you make pictures clear? Let's see if I missed any questions. Patients love it. Tell it to everyone.
Yeah,
okay.
They do love it.
I
have to tell you, so today I had a patient who did not want a pelvic exam, but my light source in my inpatient room, because I did it in a different space, I didn't have the light source I normally have, and I utilized the light on the colposcope that I was showing you guys earlier. This one.
The built-in light source. This light source, it actually has a cross polarizer to reduce glare.
Yeah, so I was able to utilize that as my light source for the patient without even, because we weren't taking photos because we didn't do a pelvic exam, she couldn't tolerate it, but I used the light source to be able to see exactly what, injury had occurred. So there's a lot of different benefits to it when, you might be going somewhere remote or, moving to a different space in your facility. I know we do that a lot.
Okay, so now I see a lot more questions here. Allison Rudd says, could you please discuss how to complete the update? Also, is it compatible with a foot pedal for taking pics? So we addressed that. We are going to, if you got an email that you're ready to migrate, that you're migrating to Carmel and you're having trouble following the directions, just reach out and we'll help you do it. And it's compatible to the foot pedal. But there was a time where it wasn't. So there was about a month and a half time where it wasn't. So it will be, if it's not yet, it will be very, very shortly. Say that again?
I used mine mine was compatible with the foot pedal. I used it last night.
Oh, beautifully, beautiful. Okay, so for whatever reason it's not working, it's just a matter of updating and we can help you out, make sure you get going. Morgan, you use the foot pedal, you answered that. Is there a discount code? No, you don't have to worry about a discount code. Just go ahead and shoot me an email. Allison, I remember you. I'll give you the discount. And if you get 2 systems, you'll get you'll get double discount. Absolutely. Each system will get 10% off. Rachel, do you use the system for documenting domestic violence case injuries, Morgan?
Absolutely. We use our system for every forensic patient that we see.
Okay. And I even heard you say that you have maybe used it in the ER completely non-related to help them capture an image for something?
I did a dog bite case.
Oh, wow. Right.
Yeah, the dog bite case that they hadn't had PD come in, and they asked me to just come in and do it because they were going to clean the patient up and they wanted to get photos prior to
Wow.
the sutures that had happened. And I said absolutely, and I just went down and got photos before they got it all cleaned up.
Amazing. And it says, do you prefer to use the hand swipe, foot pedal, or screen touch for capturing the pictures? What's your favorite?
It depends on what I'm doing. If I'm getting full body photos, I use the screen touch. I often turn off the hand gestures because I move a lot. I don't know if you guys have noticed that as we've been doing the webinar, but I don't sit still very well. So I use the foot pedal, which I have found that foot pedal is one of the most beneficial things about the system, because I can hold tissue apart. I can set my system, I can move tissue out of the way with both my hands, I can use my foot to zoom, and I can use my foot to take that picture. And you all know that sometimes you have to be an octopus with eight tentacles to be able to take appropriate photos, especially when you're doing the genital injury photos. So it just depends on what I'm doing, but I don't usually use the hand gesture one just because I move too much.
Awesome. I don't see any other questions. Does the 10% discount expire? That's a good question. We would like you to take advantage of it within a month from now. So if we think that's fair. I'm not going to give you just till the end of the month because that's not fair. So yeah. And of course, you know, if somebody misses a deadline by a day, guys, we're not like that. We're not like that. We're going to help you out. You're going to get it. Don't worry.
And I have to say that this is a really personable company. Anytime I've ever needed anything, I would shoot. I think Aaliyah was my first rep that I had who helped me, and I would shoot her a message, and then Rivka ended up being my rep, and I literally have to shoot her one message and they figure it out for me. They get all the IT issues. I'm horrible at IT, horrible. So I don't have any idea what to do. But if you have something happen on there, you can send them a message from the app when it pops up and says, send message to support. And they're available very quickly. It's not hard to communicate with them at all.
Okay, there are a couple things I'm not sure if we mentioned, and I would not want this to be over without mentioning a couple of the features. One is that it has 12 hours of battery life, so that's important for you to know as well. It's clinical use, so till you'll have to recharge it. Another thing that's good to know is that this built-in light system, it does have a cross polarizer that reduces glare. We have heard that it eliminates the need for a second light source, like an outside light source. So that is very cool. And you will have to, we provide chargers for both the light source portal charger. It's a regular Samsung charger, and for this one as well. And if you, for whatever reason, this is just also tricks of the trade, if for whatever reason you forgot to charge it and it's not charged and you need to use it, you could use it while it's charging. However, you cannot do that for the light source. So that's just like something to know. And all the software and support that comes along with it, we come up with, whenever we have a new software update, we automatically push it to your device for you. There's nothing you need to do except you'll get an email saying that we did so and that you will have to just press install update. And so we're constantly doing these improvements and making your user experience as wonderful as possible to support you in this amazing work that you guys are doing. That's all I got for now. Does anybody have any other questions before we say thank you so much and thank you, Morgan? I think we're, oh, let's see. I see something. Can you use your own phone with the device? The answer is absolutely not. The device, the phone section inside, we actually like to say that we dephone it. It cannot be used in any other way, shape, or form. And in fact, all of the images, you can't access them through gallery or folders or anything like that. We're using the technology of a cell phone because it's so easy and accessible, but it's not a phone. Don't even think of it as a phone. Okay, and I think we answered all the questions. Is it I don't want to miss anything. I believe you already described uploading to a portal, but I missed some of it. If we use a paper system for charting, can we easily download the images afterwards? For example, to hand over to law enforcement, then they pick up the kit. Morgan, you can answer that. Absolutely.
Absolutely. And, you know, at first when we started, the system wasn't as, well, they said no at first. My manager said no to use the portal at first. I have submitted some paperwork to get it approved. So they had to, they function it to where you have the ability to upload it as a zip. And then you can download that onto a flash drive. So that's actually how we have functioned the last few years since we've had it. So it's very easy to be able to do that. And they actually send you instructions when they do it. So it's very easy to do and follow.
Okay, and the last question here was about sending a recording. So anybody who who's registered, I will double check with Olga, my wonderful marketing director, but we'll be able to send everybody a recording. I don't see why not. I was doing a case last night, Sarah says, and she has a question regarding a screen I got before I started using it. When I was just putting in a date, it said camera not responding. You know what? If it didn't happen again, let's consider it a weird glitch. But if it does, definitely reach out to support.
Did it give you the opportunity to send the problem to the support team?
Yeah, that's my question. It stated you'll not be able to continue with your exam. So you're stuck. If you're stuck, then please reach out and I will help you. Let me help you with that. Let me put here, no, yes, it was locked. Okay, strange. Okay, so I'm putting in my phone number here again. You can feel free to call me and I will answer. And there we go. Oh, wait, let me just, I think I typed it in the wrong place. Okay, that's my phone number. And of course, any issue that you guys have, support at mobileODT.com, and we will always answer you. Okay? Are there any other questions about it? Anything? Okay. Does the foot pedal come with the device or is it additional? It's an additional cost. You can choose to buy it. I believe it's $150.
Do it.
Do it. Absolutely.
Do it.
Yeah, for $150 and you're getting 10% off. So it's perfect. It's almost thrown in as a gift. Everybody, thank you so much. If you have any other questions, email me. I put my email in the chat earlier. Thank you so much. Thank you to all of you, Angels. Thank you, Morgan. Thank you. Thank you so much.
Thank you for asking me to do it. And if you guys have any questions for me or you want some advice or, you know, just to chat about using it, you can email me or you can email me about anything if you want to.
Okay. Bye, everyone.
Bye, everybody.
Thank you so much.